All right, so this morning we're talking about breast cancer awareness because October is Breast Cancer Awareness Month, right? And our topic is exercise and breast cancer prevention, the strategies. So, Harry, let's just jump right into it.
All right, so this month, October, happens to be a month that we actually put in more awareness to breast cancer.
Okay.
So basically, breast cancer is just one of those forms of cancer that actually affects the breast. These abnormal cells begin to grow, they mutate, and then they multiply to almost every other part of the body, but it starts from the breast. One thing you need to understand is, in rare cases, it happens to men. Less than 1% of the cases.
Rare cases, it happens to men.
Yes, but then in most cases, it's something that really prevalent with women. So now, what are these factors that actually causes breast cancer? Because this month we're looking at making this awareness known to almost everybody, and it is very good that as a woman you're growing and as a man you're growing. It is good you go and get yourself checked time to time. You don't have to wait until it happens to you. So what are the factors that would I say causes this breast cancer? It comes with age is a factor, your environment is also a factor, your genetic is a factor. Would I also say, all right, your genetic is a factor. Being overweight or obese is also a factor, as well as medical history of breast conditions.
Yes.
And that is also a factor for you to get breast cancer. So what are the symptoms of breast cancer if you're following up correctly? So the symptoms of breast cancer is, for a lady or for a guy, you're going to see yellow pigments on your skin around your chest area.
Okay.
And then as a woman too, when they check their breast, they begin to feel if there's a lump, if there's like a seed. That is quite, the feel is different from, would I say, every other tissue that is surrounding the breast.
I know that you've talked about, some of the symptoms we can see, the coloring, but let's talk about strategies for prevention. Even before we get to the cure or even get to how exercise comes in, how can people, regular individuals, prevent this?
So there are different strategies to it. There's a pharmacological approach, there's a surgical approach, and of course, yes, there's a fitness approach. So I would always come from the fitness angle. All right. So first thing you need to understand is there are 5 stages of breast cancer. It starts with stage 0, stage 1, 2, 3, and stage 4. That makes it 5 stages. The first stage, which is stage 0, you already feel these abnormal cells. They gather around the breast region without actually invading the tissues that are surrounding the breast. All right. Now at stage 1, this cancer itself has already got into the breast and got into the subsection of the tissues inside of that breast.
Okay.
At stage 2, now you're already feeling a lump as a woman or as a man. At stage 2, what happens is the breast cancer has gone from just the subsection of your breast, and you're already feeling that there's a form of growth inside. Now this growth of the lump particularly can grow between 20 to 50 millimeters without affecting the lymph node. Now, what is a lymph node? The lymph node is like a vein that is found around the chest region, especially in the breast, and also other parts of the body. Basically, what it does is it helps us to fight infection and diseases. So I'm referring to the lymph node that is underarm around the breast region.
Okay.
So at stage 3, which is like a localized spread at stage 3, it has gone beyond the 50 millimeters in diameter, and it has affected your lymph node. And the final stage, which is stage 4, and also known as the 5th stage, because it starts from stage 0 down to 4, which is 5 stages. It has gone beyond. You can now feel the lump in your breast, and it has grown beyond the 50 millimeters in diameter, and it has also surpassed your breast. It has got into your chest area, and in worst cases, it moves to every other part of the body. It can be very fatal because it leads to death if not known in very early stage, because early detection is like the best way of managing breast cancer. I can tell you for a fact that we have athletes, professional bodybuilding female athletes that have been diagnosed for breast cancer, and they are still going for tournaments, they are still going for competitions, they still work out. So what happens is, where fitness comes into the space, if you start fitness from a very early stage in your life, you have the chances of not experiencing breast cancer. Because like I said, one of the factors that brings about breast cancer is overweight and obesity. So a cancer can actually come back even when treated if
The person is still obese.
you're still obese, if you're still on the big side. So what happens if you can build lean muscle from a very young age down to you being an older adult, and as you grow older, you don't have the chances of having
Breast cancer.
So that is this awareness that we're bringing to our people right now. Then let us say you have been diagnosed for breast cancer. Fitness can come into play.
Okay.
And if on the long run you've also undergone surgical approach, because we have what we call lumpectomy and mastectomy. Now lumpectomy is like a surgical process that involves the removal of the breast lump and other tissues surrounding the breast that have been infected by these abnormal cancer cells. Whilst mastectomy is like also a surgical approach that involves the total removal of the breast. That's why you get to realize some men or some women, they don't have the chest region. There's no breast there. So now what happens to a patient that has undergone the surgical approach? There is a postural deviation after such surgical approach. Now you begin to have a forward head. Your chest will be rounded shoulders. It comes with your cervical spine, which is just behind your neck, would bend, which is like cervical lordosis, and you also have thoracic kyphosis. So all this ailment is like a postural deviation that comes as a result of carrying out or using surgical approach to fight breast cancer. So that is where fitness comes into play, because having this postural deviation can consist of pain, can would also affect your mental health. So for a woman or for a man that has undergone this surgical approach, it is always good that you reach out to a fitness professional that understands this, and then provide you a program design that will help your range of motion when you're carrying out any form of activity of daily living.
All right. Well, I wish we had